Lots of parents find that their children wake earlier than they would like. Early rising would be defined as any wakening before 6 o'clock in the morning. Unfortunately for us as parents, beyond 6 o'clock in the morning is actually quite typical of young children. They normally wake up sometime between 6 and kind of around by 7 o'clock. Anything before that, though, would be considered early rising, and there are lots of reasons why a child may wake early. So first of all, I would encourage parents to rule out the obvious, that the child isn't waking early because of hunger, because of light coming into the room, because of a noise disturbance, or because they've become cold in the overnight period. Once you can rule out those elements, I'd then encourage you to look at other factors that can contribute to early rising. One of the biggest causation factors of early rising is actually too late a bedtime. Most things with sleep are a little bit counterintuitive, so often parents feel that if they keep their child up longer, they'll actually get a longer night's sleep out of them, but actually the reverse is true. Young children's bedtimes are typically sometime between 6 and 8 o'clock, with 8 o'clock being reserved for very well-rested children, ones that are sleeping all night and napping well during the day. I tend to try to take a mid-range view of bedtimes, especially if you are struggling with early rising, and aiming for a bedtime around 7, 7:30 can work very well to try to help you correct the issue. Some other causation factors of early rising would actually be nap deprivation, so not getting enough sleep during the daytime period. So it's important for parents to find out exactly how much sleep their child needs based on their age group, and then work from there. Another big factor for early rising would be having too big a wakeful period between the end of the daytime sleep and being in bed asleep. So it kind of ties in with the late bedtime again. It's important that most children up to the age of about 18 months shouldn't really be awake for more than 4 hours between the end of daytime sleep and being in bed asleep.